Hello and welcome to Policy Watch by PolicyTV. I'm Miberon Omoloju. Today I would like us to look at things a little bit differently and discuss the policies guiding our healthcare sector. Because the truth is, Nigeria's problem is not the absence of policies. We actually have beautiful, well-written and very structured policies. Policies that, if properly followed, Nigeria would be a completely different country when it comes to healthcare and even other sectors. But our issue has always been on one thing: implementation. That gap between what is written on paper and what actually happens in real life. Now, let's break it down by outlining some of these major policies and, more importantly, understand what they actually mean for you and I. The first one is the National Health Policy. Now, this policy is basically the foundation of the entire healthcare system. It clearly states how healthcare should be structured in Nigeria. So, according to this policy, primary healthcare should be handled by local governments, secondary healthcare by state government, and tertiary healthcare by the federal government. Now, what this simply means is that our healthcare is supposed to follow a clear flow. If you have basic health issue, you go to the primary healthcare center close to you. If it gets more serious, you move to a general hospital. And if it becomes very complex, then you're referred to a specialist or teaching hospital. The system is designed to reduce pressure and make healthcare accessible at every level. But what is happening in reality is that most primary healthcare centers are not functioning the way they should. So people skip that level completely and go straight to general hospitals. And that is why hospitals are overcrowded, doctors are overwhelmed, and waiting time is long. Now, the second one is the National Health Act of 2014. Now, this one is very important because it is the law that backs healthcare funding in Nigeria. And one major thing it introduced is something called the Basic Healthcare Provision Fund. Now, let me break that down simply. This fund was created to make sure that there is dedicated money set aside for basic healthcare services, especially at the grassroots level. In fact, by law, at least 1% of the federal government's revenue is supposed to go into this fund to support healthcare. And what is this money meant to do? Provide basic healthcare services, supply essential drugs, support primary healthcare centers, fund emergency medical treatment, and even support vulnerable groups like pregnant women and children. Now, what does this mean for Nigerians? It means that ideally, you should be able to walk into a primary healthcare center in your community and receive basic treatment without stress. There should be drugs available, there should be staff, and there should be functioning services. But then again, the question is, are we really seeing this happen? Now, the third one is the National Health Insurance Authority Act, which was signed into law in 2022. Now, this policy is meant to solve one of the biggest problems we've talked about in our previous episodes, that is the high cost of healthcare. The goal of this act is to achieve what is called universal health coverage, which simply means every Nigerian should have access to healthcare without having to pay everything out of pocket. So instead of you carrying all the financial burden when you fall sick, there's a system where money is pulled together and used to cover healthcare costs when needed. It also includes provision to cover people in the informal sector, the elderly, and vulnerable groups. And one very important thing, under this system, you're not supposed to need cash immediately before receiving treatment, except for small contributions in some cases. This means that ideally, you should be able to go into the hospital, receive care, and not have to start worrying about how to raise money immediately. But again, the reality is a lot of Nigerians are still not covered, so people are still paying from their pockets, just like before. Now, from these policies I've talked about, you'll start to notice something. The issues we've been talking about, weak primary healthcare, overcrowded hospitals, high cost of treatment, and lack of access, all of these things have already been addressed in these policies. So the real problem is not that the government does not know what to do. The problem is that what we know is not what is being fully implemented. Because if these policies were working the way they were designed to, primary healthcare would reduce pressure on hospitals, healthcare would be more affordable and the system would work better for everyone. So at this point, the conversation is no longer about creating new policies. It's about making the existing ones actually work, because until that happens, the everyday Nigerian experience will remain the same. I'm Miberon Omoloju, and this has been Policy Watch by PolicyTV. Thank you for watching.